A big thank you to the organizers for inviting me for this session and giving me an opportunity to speak on this topic, the liquid facelift. I'd appreciate if you respect patient privacy and dignity. How often do you see this in your practice? Doc, just do this for me, just lift me up. I see it fairly often nowadays. The liquid facelift, what will we cover in 10 minutes? The what and why of the liquid facelift, current concepts and perception of beauty, the aging process and relevant anatomy, the facial assessment, and the technique. A liquid facelift is a technique used for injecting advanced dermal fillers, sometimes in combination with Botox, to lift and contour facial features. It may be used for a gentle lift of the overall facial features, reduces wrinkles, creases, and folds, restoration of the natural and curved facial contours, a more rested and energetic look, and a friendlier smile. Why the liquid facelift? Because Botox and fillers appear to work synergistically, which results in greater efficacy and patient satisfaction. Botulinum toxin reduces the dynamic component of the rhytide, thereby extending the life of the filler, and it may help in decreasing skin roughness to produce a smoothing effect that may be enhanced by the addition of soft tissue fillers. What is the current concept of and perception of beauty? If we see these 6 pictures, which one do we find the most attractive? Number 5 and 6 are the usual answers to this, and it seems that regardless of nationality, age, or ethnic background, for the most part, people universally share a sense of what is attractive. An attractive face is supposed to be oval and have a good OG curve in females. The OG curve is an architectural shape which consists of a concave arc flowing into a convex arc, creating an S-shaped curve. We've shifted from a 2-dimensional to a 3-dimensional focus. Earlier, we used to merely work on hyperdynamic lines and work on the muscles to cause immobilization to decrease those lines. And now we have an increased comprehension and appreciation of the loss of volume and its effect on treatment approaches. Affecting facial beauty has gone far beyond wrinkles and furrows. And if we see this lady who's 65 years old, this is after correction of lines and folds, and this is after correction of volume and structure. So she looks much more beautiful. A review of literature on facial beauties identifies 7 key facial features, which by Dr. Arthur Swift have been named the Magnificent 7. 4 of these are amenable to contouring with injectables, which are the facial shape, the eyebrow shape, the nose, and the lips. The others can be improved with topical agents, energy devices, makeup, and hairstyle modification. And if we do that, we can achieve results such as these. This is before, this is after treatment number 1, and this is after session 2. And after makeup and hairstyle, the patient improves substantially. The aging process and relevant anatomy. There are 4 Ds to the aging face. So the triangle of youth, which is a full and wide mid face, gets deflated, which we need to reinflate. There is tissue deterioration, which we need to rejuvenate. There is descent of the facial envelope, which we need to lift. And there is disproportion, which we need to strive for proportion, harmony, balance, and symmetry. Certain areas of the facial skeleton have a strong predisposition to undergo resorption with aging, such as the mid-face skeleton, the maxilla and the piriform region, the superomedial and the inferolateral aspect of the orbit, and the pre-jowl area of the mandible out here. And these resorb in a predictable manner, and the resultant deficiencies contribute to the stigmata of the aging face. There are discrete fat compartments in the face, the forehead fat compartment, the periorbital, the cheek, and the jowl fat. And these are superficial and deep, and aging leads to abrupt contour changes between these regions, and as a result of volume loss and or malposition of specific compartments, which is why the face does not age as a confluent mass. The attenuation of these ligaments further adds to this process. These are the more important fat compartments. The superficial cheek fat compartments consist of the infraorbital, the medial cheek fat, nasolabial, middle, lateral, and the jowl fat. And the deep cheek fat compartments are the medial suborbicularis oculi fat, which is also known as the SOOF, which is out here, the lateral SOOF, the deep medial cheek fat, and the buccal fat. And the contour of the cheek is affected by the volume of the deep fat compartment, the suborbicularis oculi fat as well. The buccal fat affects the prominence of the jowl, and injection into this pre-jowl sulcus medial to this jowl fat is advisable for the augmentation of the chin area. So out here, this is attenuation of the orbicularis retaining ligament, loss of the lateral sousp, and loss of the deep medial cheek fat, no anterior projection. Out here, there is adequate deep medial cheek fat giving projection to the cheek, and the buccal fat affecting the prominence of the jowl. And when we treat this patient and try to restore this fat as well as the periorbital area, we can achieve a good result with these, with the facelift that we are trying to. So better contour and an OG curve. This is in the chin and the jowl area. So by treating with neurotoxin as well as fillers in the pre-jowl sulcus, a much more contoured lower face. The facial muscles, we have muscles of facial expression. They help in moving the skin and make the face communicative. Decreasing the activity of these muscles decreases wrinkles, smoothens furrows, creases, and gives a pleasant appearance. And there are muscles of mastication in the form of the masseter and the temporalis, which have bony attachments and function to move the jaw. The masseter may be hypertrophic and may give rise to a boxy face. This is amenable to botulinum toxin. The temporal area has the temporalis. This may be concave in certain individuals and is amenable to hyaluronic acid fillers. This is probably an important slide. I can't go into the details due to the paucity of time, but this is the arterial supply of the face, and we need to know this before we inject into the face. So the common carotid bifurcates into the external and internal carotid, and the external carotid gives off the facial artery, which is a branch of the external carotid, which climbs onto the face at the ramus of the mandible. And this is important. The anterior border of the masseter is the area you're looking for where the facial artery goes onto the face. So while defining the jawline and injecting into what we call the gonial angle, we need to be careful about this artery that we don't inject into it. Further, while the chin augmentation, the mentral artery comes into play. It breaks further into the superior and inferior labial artery. For lip augmentation, we need to be careful about this. This runs a tortuous course, goes next to the nose, wherein we fill in the pyriform fossa while injecting the nasolabial fold. So we need to be careful there. Further, during cheek augmentation, the transverse facial, the maxillary, as well as the zygomaticofacial, particularly the sousp area, which is prone to bruising. Further, the dorsal nasal artery and the angular artery while injecting the tear trough. This is a highly dangerous zone as this forms an anastomosis communicating the internal and external carotid system, so one needs to be careful while injecting this area. And further, the supratrochlear, supraorbital, and the superficial temporal arteries. Assessment and technique. Qualify your problem, quantify your problem, and prioritize your treatment. Qualify, you can demarcate the face into the upper face, the mid face and the periorbital, the lower face, and the skin. So the upper face showing temporal volume loss, a flat forehead, the mid face showing a tear trough, a flat mid cheek and a mild nasolabial fold, and the lower face showing a lack of chin projection. The skin appears dull and lackluster and a tired look. Quantify your problem, whether it's mild, moderate, or severe, and prioritize the plan as per your assessment and the patient's request. Plan for optimal and natural results. Treatment of one area in isolation has the potential for patient dissatisfaction. So I won't go into the whole technique, but these are basic points which one must know. Starting from the upper face, this is the temporal crest, and this is a danger area because it's got the supratrochlear and supraorbital artery, which have a direct communication with the ophthalmic artery, so we don't want to go there. So forehead contouring, stay on the bone, use low viscosity fillers, use a needle or a cannula, avoid these arteries. Coming to the periorbital area, go deep or superficial, use a cannula or a low viscosity filler. Cheek enhancement, be deep or superficial in some cases for restoration of the OG curve. And in the buccal fat, it appears that it's better to be superficial as no bony support, and you can use endless amounts of filler here when you're deep. Nasolabial fold, deep in the pyriform fossa, use a needle and a high viscosity filler. Chin enhancement, stay on the bone, high viscosity fillers, needle or cannula as you like. An injection on the bone for the gonial angle, use a needle or a cannula and a high viscosity filler. There are last couple of slides. There are other techniques such as the 8-point lifts, which are very, very popular. There is no single good technique. Know your basics in anatomy, have double vision, and look for the third dimension. Visualize the end result as seeing the end result before they begin treatment. It is important to recognize that one size fits none, and even though each face is similar, every face is unique. So this is a global approach. This is what you can achieve. This is after 1 year and 2 months. Again, after 2.5 years, and this is what she used to look like when she was young, and this is what she looks like today. Again, the mid-face and the jawline with botulinum toxin and soft tissue fillers. You can see the jawline. Her nose definitely still needs work. This is converting a boxy face into a more contoured lower jawline. So you can see the boxy face out here and a much more contoured look out here. And this is after 1 year of treatment. Again, a more contoured and a more fresher look. Thank you.